Do you play golf? If you've got a painful arthritic hip, you'll know that it really plays up when you're on the golf course. A lot of my patients are keen golfers, and the first thing they want to know is when they can start to play again after their hip surgery. Keep watching and I'll tell you all about it.
What's your game, Mr. Bond?
My game?
You didn't come here to play golf.
I've got a set of clubs and had some lessons quite a long time ago, but I've never really made the time to play golf often enough to get any good at it. Having said that, if someone asked me to have a round with them, I'd never say no, but I do tend to lose a lot of balls. Golf is one of the most popular sports because it's so accessible, and it doesn't really matter if you aren't very good at it. Everyone can find their own level. It's sociable, it's great exercise, and there's a lovely 9-hole course at Abington Park not far from where I live. It's just right for me. More than 1 in 20 people play golf at least once a month, and most of them are over the age of 50, so as a hip surgeon I see quite a few. Lots of pro golfers have had hip replacements, including legends like Tom Watson and Jack Nicklaus. A member of the PGA Tour Champions, which is for golfers over the age of 50, estimated that over 30% of them had had hip replacements. So what are the potential problems that golfers have to deal with after surgery, and how can they avoid them? Well, the first thing to say is that everyone I know has gone back to playing sooner or later, and they often improve their game. The biggest fear for the golfer and of course the surgeon is the risk of having a dislocation. This is where the ball of the hip replacement comes out of the socket. The risk is highest in the first few weeks after surgery when the soft tissues are healing up. My advice is not to go back to playing until at least 3 months after surgery. This gives you time to recover physically and mentally from the effects of surgery, and of course to complete your rehab. Have some sessions of physiotherapy to build your confidence and fitness. The other fear is of course slipping and falling, so wear good golf shoes and avoid the wet weather. Once you feel ready, go to the driving range and practice your swing. Don't be too ambitious at first. Start with a 7-iron and get the feel of your new hip. If it's painful, back off. Do some putting practice. As they say, drive for show and putt for dough. Once you're feeling comfortable, plan to do the back 9 and use a buggy at first. Take your time and enjoy the feeling of your new hip, which should be much more mobile and pain-free. I think that it's always worth having a discussion with the golf pro before you push things hard. Consider having a few lessons to adjust your swing and techniques. They'll have dealt with lots of players who've had hip surgery. Rehearse placing the tee and retrieving the ball a few times. You have to bend over to do these things, and it's worth trying them just to get the feel of your new hip and test your balance. There's lots of evidence to show that getting back to playing a good standard of golf is well within the reach for most people who've had a hip replacement. In fact, it's an excellent sport for developing strength, balance and core stability. There was an interesting research paper recently from Japan which looked at people who'd had hip replacements and analysed the range of movement and hip loading during the golf swing. They found that the swing did not cause excessive rotation or forces on the replaced hip, which is really reassuring. Well, I hope you found this helpful. If you'd like to know anything about hip surgery, please get in touch. The details are below in the description. Thanks for watching, and I'll see you next time.